We are nurses,
social workers,
counselors,
wellness coaches,
dietitians,
supporters,
leaders,
collaborators,
listeners,
advocates,
motivators.
The Coordinated Care Network, also known as the CCN, is a multidisciplinary team made up of nurses, social workers, a dietitian, and support staff. We focus on serving the most chronically ill patients, such as those with heart failure, COPD, pneumonia, or patients who have experienced a heart attack. Our ultimate goal, also referred to as the triple aim, is to increase the quality of care our patients receive, improve their experience with us, while at the same time working to reduce healthcare costs. One of the highlights of the program is the ongoing coordination taking place each day with staff from palliative care, home health, nutrition services, pharmacy, our medical group, physician offices, and various community services. Patients are connected to the CCN by a review of inpatient hospital lists, as well as from referrals by physician offices, case management, and social workers. Once identified, we make every effort to meet with the patient in the hospital before discharge. A staff member will educate the patient about our services and complete our screening tool. This helps us identify any biopsychosocial factors and potential barriers to their overall well-being. This is really a critical point in our care, as we're able to concentrate on engagement with the patient as well as maintain a patient-centered focus. Should a patient accept our services, a follow-up phone call is made within 48 hours to ensure their discharge was successful and to identify any barriers they have encountered. If the patient has agreed to in-home visits, we would arrange our visit at this time. Some patients prefer to receive follow-up phone calls, which we would do for about a 30-day period. One of the challenges our patients face is the rural area in which we live. There are often limited resources, which only creates further strain on an individual's mental and physical health needs. We recognize the importance of treating the whole person, so we strive to address all that could be impacting a patient's well-being. Home visits can vary from day to day. Our chronic disease nurses complete a variety of tasks, such as conducting medication reconciliation, taking vitals, managing weight, providing disease-specific education to patients and their families, and assessing for any safety issues in the home. Exercise and diet are often areas of concern for our patients, so we utilize a dietitian to provide further education. It is not uncommon for our patients to be dealing with various stressors such as issues with housing, finances, adequate and healthy food, and transportation. This significantly impacts their physical and mental health. Our patients benefit greatly from our social workers who can provide case management services as well as mental health interventions. Our team focuses on the use of cognitive behavioral therapy and motivational interviewing to find success in these areas. It is essential for our staff to coordinate with other service providers, especially physicians, to ensure our patients are receiving the most efficient and effective level of care they deserve following discharge. We strongly encourage all of our patients with heart failure to attend one of our continuing care clinics within 2 weeks after discharge. We have a weekly clinic at both facilities, which is staffed by employees from the CCN, palliative care, pharmacy, nutrition services, and cardiac rehab. These staff rotate seeing each patient within an hour's time, addressing any issues related to their specialty. It is a prime opportunity for patients to receive further education on their disease and address any barriers to their continued care.
Well, I had the triple heart bypass surgery, and while I was trying to recover, these people come to your room of all different kinds and tells you about the programs that the hospital has, and the coordinated care was one of them. And it is a wonderful program. These people are very well educated. They know what they're doing. They're very kind and considerate of your well-being. I don't know what I would have done without them. The CCN is the hospital's best kept secret.
As you can see, we are a family of dedicated SSM Health employees who are focused on improving the health and lives of our patients. Lenora's story is shared by so many of our patients, which continues to drive us towards excellence in all that we do.
We are life changers.
We are here for our patients.
They tell us we're kind of a big deal.
We are the Coordinated Care Network.